The reason I think that pharmacists should be part of patient care teams is they have a beautiful complementary skill set to physicians.
So it seems that as patients get more complicated and the medications get more complicated, it's a natural fit, particularly in primary care.
I also think that people don't know about them. They think of pharmacists as being the person behind the counter dispensing medications and don't see the value of the clinical pharmacist in really managing chronic diseases. So that's just about educating physicians and systems about the role that they can play.
So they can really step in actually for physicians in those places and free physicians up to do what we do best, which is diagnosing diseases.
I think pharmacists are critical to improving costs and improving quality.
They have a very specific skill set. They're well trained. They're not just trained in pharmaceutical science, but in physiology and other aspects of healthcare. So I would say they're a very valuable member of the team.
And having a pharmacist at our side, in addition to other team members, really rounds out an outstanding patient care team.
Pharmacists help me take care of my patients in pretty much every aspect of the care I provide as a primary care clinician.
They also do a lot of teaching for us. They're the ones who will come to me and say, hey, did you know that now you can get this in an oral format, or now can you get this in a higher dose, or now the indication for this also includes this new disease. So they do a lot of teaching with us.
And finally, I would say they're incredible partners as faculty teachers. They sit in precepting with the MD faculty, and they're able to field questions from residents as they come in to check out patients.
Pharmacists often aren't included in healthcare provision teams, and it's a shame because very often we need their expertise to make efficient decisions that are good decisions.
Pharmacists have been proven to actually decrease readmission rates, 30-day readmission rates. And the reason is one of the main causes of readmissions is patients' failure to follow through with the medication changes that we have made on the inpatient side, whether it's through access, through understanding, through confusion, through changes. The pharmacists, by their follow-up and diligence in focusing on that aspect of the care, allows, again, the care team to function more efficiently.
Our pharmacists educate us, they also educate our patients, and to be frank, they're better at educating our patients, particularly in things like how to use inhalers correctly, how to start insulin, and how to prevent some of the complications from giving yourself insulin, what things to look for, what things to stop your medication for. Our pharmacist spends lots of time going over that, and then it's very accessible in case the patient has a question or has a complication afterwards.
Getting pharmacists engaged in clinical practice will probably take a bit of education of the primary care providers or practices or health systems that are managing the practices to see the value from a patient care perspective, from a value perspective, and enabling more seamless, coordinated care through the continuum of one's life. And even having some experiences with best practices and being exposed to how best to make it work efficiently in a busy primary care practice.
I think it's lack of imagination that pharmacists aren't included in more patient care teams.
We all know the value of our pharmacy colleagues. You talk to nurses, you talk to physicians, PAs, NPs, all of us would say we couldn't survive without our pharmacists in both the hospital setting as well as in the outpatient setting.
I think that the best way to get started is to work with either the School of Pharmacy or a residency program in order to engage learners as an initial step.
For us, obtaining pharmacy support within our clinic wasn't entirely easy to begin with. And we had to approach our administration with the request to have that resource. And over time, we were able to demonstrate that having a pharmacist within our team helped to improve care and helped to reduce costs through reducing hospitalizations and medication non-adherence, so much so it was able to be a clear winner with a return on investment for the administration and, more importantly, for our patients. Medicine is turning more and more into a team sport.
Thinking about medicine as a team sport, it just doesn't make sense to leave such a great team member on the bench, essentially. And I think when we do, we really do that, we really limit the scope of what we're able to offer patients, essentially.
There are a lot of things to consider when expanding a healthcare team in a busy primary care practice. I think as we get further along in the care of patients and the care of complex patients in the ambulatory setting, it behooves us to expand our team accordingly.
But once you've had a taste of a life with a pharmacist as your partner, you don't want to go back.